really think that that makes absolutely no sense. Having your feet cut to fit shoes, I'm against that. The majority of patients I see come in, they have painful bunions, they have painful corns, and they need a surgical procedure. They've tried conservative therapy, and they want to wear nice shoes. It's not about, you know, correcting your feet to fit into Manolo Blahnik.
It's just so that you're out of pain. Really, you want to be out of pain so that, okay. What about this procedure called the Perfect 10, where it shortens your toes? I've heard of this, actually.
Well, you have the perfect 10.
Well, I have a size 10. I don't know about that. But
you have the perfect 10.
But I have this one little thing right here where there's like that extra little joint, so there's like a little corn right there.
No, that would be perfection. Your feet look perfectly fine, okay? I mean, there is absolutely nothing to be done.
So no surgery for me
No surgery for you.
Okay.
And I wouldn't suggest doing any surgery on anybody unless you had a pain.
All right. Well, let's talk about the hammer toe and the hammer toe procedure and toe shortening. This is them right here. Okay, look. I'm going to. I think I'm getting a hammer toe. You have to tell me. See, like, look right there. See that thing?
But you know what? You have a bunion. You have
I do have a terrible bunion. Ah, it looks so gross. But I'm serious.
And you know, we've talked about that before. But I said it's not bothering you, and just leave it alone.
But I have trouble getting some shoes.
Well, okay. So we have to look for wider shoes, and probably the best thing to do is to actually put a little arch in there and stretch your shoes before. But if you were to have surgery, I mean, you're looking at 4 to 6 weeks for the bone to actually heal.
And a doctor told me that you can't do both feet at once. Is that correct?
It's not a great idea unless you have someone taking care. You know, you can't walk and put
you can't drive a car. You can't do any of that after you have it.
The difference is, though, is today you can do it on a Friday and go back to work on Monday wearing a surgical shoe.
Let's talk about fat injections. I believe that's what we have pictures of next.
Yes. Now, I don't do the fat injections, but I do pillows for your feet. It's a cushioning procedure, similar to the material that's injected in your face to plump up your face, and that works. I mean, it really works wonders. I have a 93-year-old patient that comes in and says, fill it up. So, I mean, it's really a great procedure.
Well, talk about filling your face. I cannot believe that you can actually use Botox in your feet. What does that do?
Okay. Now, Botox in your feet, that's a little different, okay? Botox is used for hyperhidrosis. That's when you feel like all of a sudden your feet are wet and you feel like you're perspiring. You're running in your sneakers and your shoes. You use Botox rather than do surgery. It does.
Okay, talk about lasers and foot facials.
Okay, now here's interesting. Lasers are new. Lasers came into being the last 10, 15 years. We can now use it for fungus. Instead of using oral antifungals that can cause a lot of liver problems, you can now use a laser to get rid of fungus. And you know, it's unsightly to see that. You don't have